Hi, my name is Rosemary Mills. I'm an RN and I'll be presenting information on signs and symptoms of getting sick and when to stay home from work or school. Did you know being sick is never fun? But did you know that there are many things you can do to prevent illness? Some signs and symptoms of getting sick are a temperature higher than 100 degrees Fahrenheit, a productive cough and or a sore throat, a runny or excessively stuffy nose, headaches and or body aches, chills, fatigue or just general malaise, nausea, vomiting, or diarrhea. So when should you seek emergency medical care? If you start having difficulty breathing or excessive shortness of breath, if you get purple or blue discoloration of your lips or nails, if you suddenly have pain or pressure in your chest or abdomen, if you get sudden dizziness for no reason, or if you start becoming confused, you don't know where you are or what you're doing, if you have persistent or severe vomiting or diarrhea, especially if it lasts longer than 24 hours, if you get any type of a seizure, or if you have flu-like symptoms that improve but then return with a fever or a worsening cough, please seek emergency medical attention. So, the most important thing we all want to know is when do you get to stay home from work or school? If you get a runny nose with sneezing, you're tired, you have body aches, and a fever, stay home. If you get an ear infection, they're not contagious, but they're really pretty painful. You'll want to stay home. If you happen to get pink eye, it's highly contagious. You do not want to share it with us. Please stay home. If you have any nausea, vomiting, or diarrhea, built-in excuse, stay home. If you get a headache with sensitivity to noise and light, it could be a migraine. You'll want to stay home. But if you just have the sniffles, a light cough, and a scratchy throat, but you're not achy, feverish, and you can hold down food, sorry, you get to go to work or school. In a recent study by Gundersen Health System in 2015, they found that employees coming to work sick cost employers about $180 billion annually in lost productivity. So please do us all a favor, stay home when you're sick. Now the sad part, when do you have to come back to work or school? Come on back when you haven't had a fever, nausea, vomiting, or diarrhea for 24 hours. If you don't have a productive cough anymore, or it is significantly improved, or if it has been at least 5 days since you started to become sick, you can come on back. Really, come back when you're 100% better. Coming back any sooner and you're just going to have a relapse. Thank you.
Hi, my name is Kayla Rom. I'm an RN and I'm going to be speaking to you about how getting enough sleep, exercising, and how a healthy diet can help prevent you from getting sick. So let's start with sleep deprivation. For you college students, not only is getting enough sleep important for your health, but it is rated the second leading cause of poor academic performance by college students. The first is stress. Why is sleep so important? A regular and restful sleep is important for your mind, body, and overall health. Sleep influences your mood, energy level, ability to learn, your memory, reaction time, efficiency, good judgment, stress levels, and making healthy choices in your diet. This will come as no surprise, but college students are one of the most sleep-deprived populations. The average adult needs at least 8 hours of sleep a night, maybe even more, and they are getting an average of 7 or less hours of sleep per night. Because of this, more than 1/3 of adults report daytime sleepiness that interferes with work, school, or social functioning. So, just sleeping in on the weekends to make up for the lack of sleep during the week is not quite cutting it, and it is damaging to your health. So how does sleep actually work in the body to improve your health? As we all know, sleep restores energy expended each day, and it's necessary for us to function. But some things that we may not know are that hormones are released when we sleep that help fight infection. Sleep helps reduce the stress on our hearts by lowering the heart rate and blood pressure. And finally, your brain uses sleep to create new pathways for learning and memory retention. So staying up late and cramming for that test may not be as good of an option as getting a good night's rest. Now that we know why we need to sleep, how much sleep do you actually need to maintain your health? This is going to be different for every person, so one way that you can determine how much sleep you need is by spending 1 week waking up naturally without an alarm clock. It's recommended that you use a sleep diary for this time to track the amount of sleep you get each night. Once you've determined the correct amount of sleep for you, try going to bed and waking up at the same time each night to maintain this pattern. Don't rely on the weekends to catch up on sleep. This only worsens your sleep patterns. And finally, it is recommended that you only sleep in 1 extra hour than normal on the weekends to help maintain this pattern. As I mentioned before, your diet and sleep are closely related. Not getting enough sleep affects your insulin sensitivity. This can cause increased cravings for high calorie and high sugar foods. So, for those of you who may be trying to cut back on certain foods, getting enough sleep is crucial for your success. A few tips for getting a good night's rest are try to get outside in the daylight each day, try to exercise daily, and try to eat meals regularly. Doing these things will help to preserve your sleep-wake cycle. Try to limit caffeine and nicotine after lunchtime. These are both stimulants and can disrupt your sleep. You should also avoid alcohol close to bedtime. Many people believe that drinking alcohol helps them sleep, when in reality it disrupts your sleep. Practice time management with homework to prevent cramming and all-nighters. Avoid napping, as this disrupts your sleep-wake cycle. Go to bed only when you are sleepy. If you've been in bed for longer than 20 minutes and you can't fall asleep, leave your room and do a relaxing activity such as deep breathing and return to bed when you are tired. Use your bed only for sleep and sex. This associates your bed with sleepiness. And finally, go to bed and wake up at the same time each day. Let's move on to diet and exercise. Did you know that 30.3% of adults aged 20 to 39 are obese? Their annual healthcare costs are $1,429 than a non-obese adult. Dr. Russell Platt from the University of South Carolina tells us that our bodies were designed to be physically active, and they don't do well with long-term exposure to sedentary living. Lack of physical activity is a major risk factor for cardiovascular disease. Some of the benefits of exercise are to control your weight. This could mean maintaining or losing weight depending on your goals. It reduces the risk of cardiovascular disease, type 2 diabetes, metabolic syndrome, and some cancers. It strengthens your bones and muscles, improves your mood and mental health, and improves the chances of living longer with a greater quality of life. In other words, it helps to improve your health. And one added perk is it can improve your self-confidence. The Department of Health and Human Services recommends that 150 minutes of moderate aerobic activity like walking or 75 minutes of vigorous aerobic activity like are included each week. Strength training should also be done twice a week. A good goal is to aim for 30 minutes of activity a day. If you have specific goals in mind, you may have to exercise more often than this. This is just the minimum to maintain a healthy body. For those of you who may struggle finding the time to exercise, here's something to consider. Thomas Jefferson said, "To be successful in academic studies, a person should give about 2 of them every day to exercise, for health must not be sacrificed to learning. A strong body makes the mind strong." In other words, exercise is not only beneficial for your health, but for your academics. Here are a few tips for fitting exercise into your daily routine. If you don't have 30 straight minutes to dedicate to exercise, try dividing your physical activity into 2 or 3 10 to 15 minute segments. Take the stairs, park in the back of parking lots, and walk to your destinations. Walk or ride your bike to class, or join an intramural sports team. As you can see, Simple things can help to improve your health. Choosing healthy foods can reduce the risk of heart disease, cancer, and other illnesses like the flu or common cold. Up to 60% of cancers have been shown to be diet-related, so improving your diet can help decrease your risk for cancer. Ensuring a diet high in vitamin A, vitamin B2, vitamin B6, vitamin C, vitamin D, vitamin E, and zinc is also important to improving your immunity. These vitamins and minerals are essential for your immune system to function properly, so feeding your immune system what it needs is a great way to prevent illness. Having a healthy diet generally means eating a diet high in fruits, vegetables, whole grains, and low in saturated fat. For more information on what foods you should be eating based on your gender, weight, and level of physical activity, visit www.choosemyplate.gov for recommendations that are specific for your lifestyle.
Hi, my name is Susie Stosich, and I'm also an RN. I will be presenting the third and final segment of this illness prevention video. Did you know that you can get sick from droplets coming from a person's cough from only 6 feet away? That means that, in most classroom settings, you would be a moving target from at least 8 different directions. This is how most respiratory illnesses are spread, by coming into contact with these contaminated droplets that are catapulted at you through the coughs and sneezes of others. So, what can you do to keep from passing these lovely germs on? First, when you're coughing or sneezing, cover your nose and mouth with a tissue. This will catch those contaminated droplets and keep them from going any further. If you do not have a tissue available, you can use your sleeve or cough into your elbow. When using tissues, don't forget to thoroughly wash your hands. Finally, educate others to do the same so that you will be protected from the coughs and sneezes of others. Now, a little about that hand washing. Did you know that there was a study conducted by researchers at Michigan State University to observe how well people wash their hands after using the bathroom? They found that only 5.3% of the people washed their hands correctly. Meanwhile, 22.8% did not use soap, and 10.3% did not even attempt to wash their hands at all. This may seem elementary, but many of us need to be taught or even reminded on how to do this correctly. First, using clean water at a comfortable temperature, wet your hands with water. Next, scrub your hands for at least 20 seconds between the fingers, underneath your nails, and on the front and back surfaces of your hands. Some people like to sing the Itsy Bitsy Spider song, the ABC song, or Happy Birthday song twice to help them get these important 20 seconds in. Then, rinse your hands thoroughly with the clean water to remove soap residue from your hands. Finally, air dry your hands or dry them off with a clean towel. Remember, the basics can make all the difference between clean and latrine. So when is it okay to use hand sanitizer instead of the traditional soap and water? You can use hand sanitizer when soap and water are not available, or when your hands are not visibly dirty or greasy. The best hand sanitizers contain at least 60% alcohol, because these are considered to be the most effective at killing disease-causing microbes. Another way that you can help prevent illness is by being up to date with recommended immunizations. Did you know that 3,000 to 49,000 people died each year in the United States from an influenza-related illness between 1976 and 2007? Many people are unsure of what exactly the flu is. Influenza, aka the flu, is a serious respiratory illness caused by a highly contagious virus. Symptoms of influenza include fevers, chills, cough, sore throat, congestion, and body aches. The flu season typically runs from October to May of each year. The young, old, or immunocompromised are particularly at risk for getting sick and having serious complications from the flu. However, anyone can get sick. To help prevent getting the flu, an annual influenza vaccine is recommended. A flu shot is needed yearly because influenza strains are constantly changing. Each year, researchers determine which strains will likely be the most prevalent, and then vaccinations are made to counter these strains. You can get your annual flu shot at a doctor's office or even at a local pharmacy at your favorite grocery store. Another important immunization to consider is the meningococcal meningitis vaccine. Meningococcal meningitis is a bacterial infection affecting the meninges, or outer membrane, of the brain and spinal cord. Infection with this bacteria causes rapid onset swelling in the brain and is truly a medical emergency. Most common symptoms include a fever, headache, and a stiff neck. College students are more susceptible to meningococcal meningitis due to their hectic, stressful, sleep-deprived, close-quartered, malnourished lifestyles. Sound familiar? Recognizing this problem, more and more colleges are requiring that their students be immunized, and one or more meningococcal vaccines may be recommended for you. The following chart outlines the recommended vaccines for adults by their age group. How up to date are you? It is never too late to get vaccinated. Also, remember that it usually takes about 2 weeks after being vaccinated for your body to become fully equipped to stave off encounters with disease. As you can see, there are many great resources out there to help you on your path to a healthy lifestyle. These are just a few that we use to help educate you. Good luck and stay healthy.